The preventive aspects, unlike the curative potential of MARMACIKITSA, which was explored to a great detail in the various literature of southern India. However, the management of marma injury is not described separately because the management of marma injuries are to be done similar to Vranacikitsadam and Sadiovrana-Cikitsa, if there is an acute external injury, and by the principles of Bhagnacikitsa if there is a Bhagna involved. The methods described under Sastyupakrama are to be specifically utilized as per the condition of the patient. The management of residual damage is to be done in lies of general dosa cikitsa in terms of both sadhana and samanacikitsa, especially utilizing the principles of treatment of vata dosa. The principles of bandhanavati, rudiranav-ravidhi, abhyangamardana etc. may be used appropriately. As based on the symptomatology, management of principles various such diseases sannyasacikitsa, vatavayadacikitsa, especially avara-acids, trimarmia cikitsa etc. may be utilized. Use of general principles of management of srota-dusti such as adipravti, sanga, siragranthi and vimargagamana, by selective use of chola and sthira guna by stimulation or bandaging respectively. Thus, if there is excessive movement of a part due to injury, it is immobilized by bandhana. If there is stiffness, sanga, it is loosened by abhyangam, svedana etc. If there is vimargagamana, first manipulation is done to bring it back to the original site and then bandaging is done to stabilize it at the correct site. This is an example for the use of appropriate methods or techniques of bandaging, massaging or both as per logical reasoning and requirement. Abhyangam is done on the skin, which is one of the main seat of Veda. Afflication of marma points usually indicate bad prognosis and is mostly asadhya. Ayurveda uses the natural responses of the body in the management of diseases. The same is true in case of MARMACIKITSA also. The natural orifices are utilized in panchakarma to remove the excess dosa. Similarly, it can be observed that most of the natural responses of the body during an injury to a particular body part or a disease/symptom affecting a particular region are identified and utilized in MARMACIKITSA. When a body part is hit, it is a natural reaction to rub that part with the palms. This displaces the pra localized at that site due to the trauma and thus relieves the pain. Similarly, people with headache usually hold over the region of sankha marma or tie a cloth around the sankha and sthapani marma to block the aggravated vata. There are numerous other examples such as rubbing/pressing of the eyes after sitting too long in front of a screen, tapping over the temples or center of eyebrows while thinking deeply etc. These are examples of subtle usage of marma points. Thus, even though MARMACIKITSADAM is not described as a separate chapter or by this name, the concepts of marma injuries are clearly of management described in Susruta Samhita. Apart from these, the texts have given elaborate freedom to explore and learn from other contemporary sciences, and thus principles of Dhanurveda, Tantrasastra, Mantrasastra, Alankarasastra and other Vedic, Upanishadic, Puric literature etc. can be used to expand the clinical practice. Acharya Karaka has described that he has only described concepts of use of plants and that one has to learn the identification of plants from the cowherds and goatherds by going into the forest. Similarly, various practices which are prevalent and useful are to be explored and understood using the principles of one's own sastra and used to enrich the sastra. In this way, the therapeutic manipulation of marma points can be done taking cues from the various available literature after analysis using the fundamental principles of Ayurveda. Marma and Varma. The words marma and varma are extensively used in Sanskrit literature, and there are numerous references of both these words even in the Vedic literature. However, the word marma is used more in the meaning of vital points, whereas the word varma is used more in the meaning of a protective covering. If we look at the etymology of both these rods, the word marma is derived from the Sanskrit root mrn pratiji, meaning that which causes death. The word varma is derived from the root vrn varani, meaning that which covers or protects. This protection may be in different forms such as through mantra, kavaka, armor, or even the king, who is the protector of the people. The word marma thus gives a negative connotation of causing death, whereas the word varma gives a positive connotation of covering, protecting, etc. Both the words marma and varma are of ancient origin and are found even in the Vedic literature. There are even references in the Rigveda where both the words marma and varma are used in the same verse. However, the commentators explain that the word used for vital or vulnerable point is marma, whereas the word varma denotes a protective covering, which may be physical or non-physical covering such as an armor or mantra. Marma in Vedic and other Sanskrit literature. Apart from Ayurveda literature such as Karaka Samhita, Susruta Samhita, Astangardaya and Astanga Sangraha, the word marma is mentioned in many of the ancient literature written in Sanskrit such as Veda, Rigveda, Atharvaveda, Grihya Sutra, Bodhayanagriya Sutra, Upanishad, Garbhopanishad, Smriti, Yajnavalkya-smriti, Itihasa, Mahabharata and Ramayana, Purana, Bhagavatapura, Karmapura, Lingapura, Matsya Purana, Vyupara, Garuda-pura, and other famous Sanskrit literature such as Kiritarjuniya, Arthasastra, Kamasutra, Kathasarit-sagara, etc. The word marma is found in the 1st, 3rd, 5th, 6th, 8th and 10th mandala of Rigveda. RV 6, 75, 18.1, the hymn on the weapons of war as translated by Griffith states, "Thy vital parts one cover with thine armor, with immortality King Soma clothe thee." This verse has an additional importance that in this verse, both words marma and varma are used together 24. The same verse is found in the Atharvaveda, Saunaka, at 7, 118, 1.1. This shows that the knowledge of marma points is as old as the Rigveda and that this knowledge had practical applications in warfare. The usage of marma in warfare also indicates its importance in treatment of war injuries. Among Upanishad literature, the mention of 107 marma points are found in the Garbhopanishad 2.5. The word marma appears numerous times in the Mahabharata. Mahabharata 8, 11, 2.2 describes the word marmanya for a person well versed in marma 26. Similarly, in the Ramayana also, the word marma appears on numerous occasions. In books like Arthasastra and Kama Sutra, the word marma is also used in the meaning of secret or weakness of a person. Marma in Ayurveda literature. According to Ayurveda, the fundamental components of the human body are dosa, dhatu, and mala. The life force in the body is called by the name prana. According to Dalhana, the word prana means that which enlivens or leads life forwards. According to Susruta, Agni, fire, in the form of 5 types of pitta, Pakaka, Brajaka, Alakaka, Ranjaka and Sadaka, enlivens by digesting the food, Soma, watery principles such as Slesma, Rasa and Sukra, which enlivens by nourishing Dhatu and Ajas, Vu, air with its 5 subtypes such as Prana, Apana, Vyana, Udana and Samama, which enlivens by movement of bodily substances and breathing, Sattva, Rajas, 24 Marmani te Varma Chadayami Samastvarujmtenyavastam. Rigveda 6/75/18.1. 25 Saptadaram Marmasadam, 1, 12.4. Sarvamarmani Samprexia Marmanyo Laguhastavat. Tamas, 3 Mahaguna, which enlivens by controlling the functions of the mind, Pafsandriya, the 5 sense organs Sravna, Darsana, Sparsana, Rasana and Grana, which enliven by its functions of hearing, vision, touch, taste and smell, and Bhutatma, which enlivens by being the source of consciousness, are the 12 prana. These 12 even though situated all over the body, are especially localized at certain points/areas of the body. These points/areas are thus called seats of prana or prasthana. This is the functional definition of marma in Ayurveda. On the other hand, the structural definition of marma according to Ayurveda is that marma are the meeting points of mamsa, sira, snayu, asthi and sandhi. 27 107 Such important locations where prana is specifically located are called as marma. Since marma is the seat of prana, injury to these marma hampers the jivana or process of life and thus lead to death or loss of function. Since function is based on structure, marma has both structural and functional aspects. The structural aspects include classification such based on the constituent structure such as mamsa, asthi, snayu, damani, Sira and Sandhi. According to Susruta, no marma is made of only one structure. But the classification of marma is done based on the predominant structure located at the point/area. Based on Sadanga, sixfold classification of body based on region, the marma can be localized to the upper or lower limbs, trunk, which includes chest, abdomen and back, and head along with the neck. So marma are also classified based on the location on the body. Since large number of marma are concentrated in the small area of the head, the whole of head is considered as one mahamarma or major marma. Apart from the head, hridaya and busti are also included under mahamarma 28. Looking from a tridosa viewpoint of classifying the human body based on areas of predominance of dosa, siras is a kapha marma, hridaya is a pitta marma and busti is a vata marma. Even though marma are described based on the surface anatomy, they need not be superficial structures. Marma are a part of the Madhyamarogamarga and are therefore deeply seated in the dhatu. The surface description along with their measurements described in angula should be considered for the exact localization of the marma points. The size of marma points vary from 1/2 angula, 1 angula equals 1 finger breadth of that person, and maybe 1, 2, 3 angula or size of the palm. Based on the result of injury, marma may cause instantaneous death to marmanium sasirsnivasthisandisanipt, tessus vabhavata visasena pranasdisthanti. Susruta samata sararasthanam pratyakamarmanirdasasaram. Eva. 28 Marmani Bhatim Hridayam Saraska Pradhanabhatani Vedanti Taj. Karaka Samata Sikitsasthanam Trimarmya Sikitsadam. Death within a fortnight, Sadhya Prahara, from a fortnight to 1 month, Kuntara Prahara, that which causes deformity but not death, Vaikulyakara, and that which causes severe pain, Rujakara. Apart from these, one more classification is the Visalyana marma where the person dies on removal of the impacted foreign body. This prognosis is described when the exact location of the marma is injured. If the area nearby or in the vicinity of the marma is injured, the impact would be slightly of lesser complication. Thus, if area near to a Sadhya Prahara marma is injured, the results will be similar to a Kuntaraprahara marma injury. Similarly, if the area near to a Kuntaraprahara marma is injured, the result will be similar to a Vaikulyakara marma injury etc. Affliction of marma may need not be always as a result of external injury. The vitiated dosa in the body can affect the dhatu located at the marmasthana and cause marma injury. These are called nijamarma bhagata. Many such systemic diseases affect the marmasthana and cause death or disability. Thus, a long-standing prameha can affect the basta marma. Likewise, injury to hridaya marma may be caused by abhisyandi ahara. This is how principles of MARMACIKITSA become useful in the management of common disease conditions. Marma and Pankamahabhata. According to Susruta, all Sadhya Prahara marma are Agneya, predominant in Agni Mahabhuta, Kuntaraprahara marma. Are both Agneya and Samya, predominant in both Agni and Jala Mahabhuta, Vaikulyakara marma are Samya, predominant in Jala Mahabhuta, Rujakara marma are predominant in Agni and Vayu Mahabhuta and Visalyana marma are predominant in Vayu Mahuta. The details of marma points described in Ayurveda are as follows. Name of the number marma, location, structure, paranama, agnisomayatva, hinatva, vidhalaka. Adhipati 1, Jatrurdva marma, Sandhi marma, Sadhya Prahara, 1/2 angula, Agneya, immediate death, Ani, 4, 2 + 2, Saka marma, Vaikulyakara, 1/2 angula, Samya, increase in swelling and stiffness of the Amsa, 2, Prastha marma, Sneha marma, Vaikulyakara, 1/2 angula, Samya, Trihina, Mamsa, Sira, Sandhi, stiffness of upper extremity. Amsaphalika 2, Prastha marma, Asti marma, Vaikulyakara, 1/2 angula, Samya, Trihina, Mamsa, Sneha, Sandhi, atrophy and loss of sensation in upper limb. Apana, 2, Jatrurdva marma, Sira marma, Vaikulyakara, 1/2 angula, Samya, Trihina, Mamsa, Sneha, Sandhi, blindness or diminished vision. Apastamba, 2, Euromarma, Siramarma, Kuntaraprahara, 1/2 Angula, Samyagniya, Ekahina, Mamsa, filling up of chest with air, pneumothorax, and leading to death from cough and dyspnea. Apalapa, 2, Euromarma, Siramarma, Kuntaraprahara, 1/2 Angula, Samyagniya, Ekahina, Mamsa, conversion of blood to pus, empyema, and causing death. Avarta, 2, Jaturdva Marma, Sandi Marma, Vaikulyakara, 1/2 Angula, Samya, Trihina, Mamsa, Sneu, Sandi, Trihina, Mamsa, Sira, Sneu. Brati, 2, Prastha Marma, Sira Marma, Kuntaraprahara, 1/2 Angula, Samyagniya, Ekahina, Mamsa, complications due to excessive hemorrhage leading to death. Indrabasti, 4, 2 + 2, Saka Marma, Mamsa Marma, Kuntaraprahara, 1/2 Angula, Samyagniya, Ekahina, Asti, death due to hemorrhage. Gouda, 1, Yadara Marma, Mamsa Marma, Sadhya Prahara, Panatala/4 Angula, Agneya, immediate death. Name of the Marma, number, location, structure, Paranama, Paramana, Agnisomayatva, Hinatva, Vidhalaksana. Gulfa, 2, Saka Marma, Sandi Marma, Rujakara, 2 Angula, Agnaveyu/Pankabuddha, Dvihina, Mamsa, Sira, Sneu, Asti, painful, rigid or limping foot. Hridaya, 1, Euromarma, Sira Marma, Sadhya Pranahara, Panatala/4, Agneya, immediate death. Janu, 2, Saka Marma, Sandi Marma, Vaikulyakara, 3 Angula, Samya, Trihina, Mamsa Sira, Sneu, limping. Kaksadara, 2, Saka Marma, Sneu Marma, Vaikulyakara, 1 Angula, Samya. Trihina, Sira, Asti, Sandi, Monoplegia. Katikataruna, 2, Prastha Marma, Asti Marma, Kuntaraprahara, 1/2 Angula, Samyagniya, Ekahina, Mamsa, loss of blood, causing pallor, discoloration, disfigurement and death. Krikatika, 2, Jaturdva Marma, Sandi Marma, Vaikulyakara, 1/2 Angula, Samya, Trihina, Mamsa Sira, Sneu, instability of the head. Ksipra, 4, 2 + 2, Saka Marma, Sneu Marma, Kuntaraprahara, 1/2 Angula, Samyagniya, Kukundra, Ekahina, Asti, death results due to convulsions. Kukundra, 2, Prastha Marma, Sandi Marma, Vaikulyakara, 1/2 Angula, Samya, Trihina, Mamsa Sira, Sneu. Trihina, Mamsa, loss of sensation. Sneu, Sira, loss of sensation and movements of the lower limb. Kirka, 4, 2 + 2, Saka Marma, Sneu Marma, Vaikulyakara, Panatala/4 Angula, Samya, tremors and rotation deformity of foot. Kirkasira, 4, 2 + 2, Saka Marma, Sneu Marma, Rujakara, 1 Angula, Agnaveyu/Pankabuddha, Dvihina, Mamsa, Sira, Sneu, Asti, pain and swelling. Kirpara, 2, Saka Marma, Sandi Marma, Vaikulyakara, 3 Angula, Samya, Trihina, Mamsa Sira, Sneu, contracture. Lohitaksa, 4, 2 + 2, Saka Marma, Sira Marma, Vaikulyakara, 1/2 Angula, Samya, Trihina, Sneu, Sandi, Asti, loss of blood, leading to paralysis or death. Manabanda, 2, Saka Marma, Sandi Marma, Rujakara, 2 Angula, Agnaveyu/Pankabuddha, Dvihina, Mamsa, Sira, Sneu, Asti, loss of function. Manya, 2, Jaturdva Marma, Sira Marma, Vaikulyakara, Panatala/4 Angula, Samya, Trihina, Mamsa, Sandi, Asti, loss of speech, defective voice and loss of taste. Matraka, 8, Jaturdva Marma, Sira Marma, Sadhya Pranahara, Panatala/4 Angula, Agneya, immediate death. Nabi, 1, Yadara Marma, Sira Marma, Sadhya Pranahara, Panatala/4 Angula, immediate death. Nila, 2, Jaturdva Marma, Sira Marma, Vaikulyakara, Panatala/4 angula, Samya, loss of speech, defective voice and loss of taste. Nitamba, 2, Prastha Marma, Asti Marma, Kalantara Pranahara, 1/2 angula, Samyagniya, Ekahina, Mamsa, atrophy of the lower part of the body and weakness leading to death. Name of the marma, number, location, structure, Paranama, Paramana, Agnisomayatva, Hinatva, Vidhalaksana. Parsvasandi, 2, Prastha Marma, Sira Marma, Kuntaraprahara 1/2 angula, Samyagniya, Ekahina, Mamsa, death due to filling of the cavity, pelvis, with blood. Fana, 2, Jatrurdva Marma, Sira Marma, Vaikulyakara, 1/2 angula, Samya, Trihina, Mamsa, Sandi, Asti. Sankha, 2, Jatrurdva Marma, Asti Marma, Satya Pranahara, 1/2 angula, Agneya, Anosmia. Srigataka, 4, Jatrurdva Marma, Sira Marma, Satya Prahara, Panatala/4 angula, Agneya, immediate death. Simanta, 5, Jatrurdva Marma, Sandi Marma, Kuntaraprahara, Panatala/4 angula, Samyagniya, Ekahina, Mamsa, insanity, fear and mental breakdown leading to death. Stenamula, 2, Euro Marma, Sira Marma, Kuntaraprahara 2 angula, Samyagniya, Ekahina, Mamsa, filling up of cheese. Tea with kapha and leading to death from cough and dyspnea. Stanarohita, 2, Euro Marma, Mamsa Marma, Kuntaraprahara, 1/2 angula, Samyagniya, Ekahina, Asti, filling up of the chest with blood, hemothorax, and leading to death from cough and dyspnea. Stapani, 1, Jatrurdva Marma, Sira Marma, Visalyana, 1/2 angula, Vayavya, Trihina, Mamsa, Sira, Snayu, similar to Utksipa. Talardaya, 4, 2+2, Saka Marma, Mamsa Marma, Kuntaraprahara, 1/2 angula, Samyagniya Ekahina, Asti, pain leading to death. Urvi, 4, 2+2, Saka Marma, Sira Marma, Vaikulyakara, 1 angula, Samya, Trihina, Mamsa, Sira, Snayu, oss of blood leading to wasting of the extremity. Utksipa, 2, Jatrurdva Marma, Snayu Marma, Visalyana, 1/2 angula, Vayavya, Dvihina, Mamsa, Sandi, person survives if a foreign body remains lodged in this marma point or if it is allowed to come out after suppuration. Death occurs if the foreign body is extracted immediately. Busti, 1, Yudara Marma, Snayu Marma, Satya Pranahara, Panatala/4 angula, Agneya, immediate death, except in a wound created for removal of calculus. Vidura, 2, Jatrurdva Marma, Snayu Marma, Vaikulyakara, 1/2 angula, Samya, Trihina, Mamsa, Sira, Sandi, deafness. Vitapa, 2, Saka Marma, Snayu Marma, Vaikulyakara, 1 angula, Samya, Trihina, Mamsa, Sira, Sandi, impotency or oligospermia.